frequency for taking a temporal artery temperature for MA130. The first thing on your checkoff list is going to tell you to go to the other room and wash your hands and gather your equipment. So I've already done that piece. I've washed my hands. I have my patient's chart. I have a black pen, and I have a temporal artery thermometer already in the room. The next step is to call my patient, identify my patient, and explain the procedure. So, Jessica?
Yeah.
Hi, Jessica. How are you?
Fine, how are you?
Good. We're going to go right here into curtain 2. You'll have a step up on the table for me. Perfect. All right. So, Jessica, can I get your birth date, please?
6/12/85.
Okay, perfect. That's what I have here. The doctor wants us to go ahead and get your temperature to get started with, okay? I'm going to use a temporal artery thermometer, so I'm going to use your forehead, okay? So I want to explain the procedure to my patient. I've identified her by her birthday, and when I use the temporal artery thermometer, what I want to do is I want to visually look at my patient to make sure she doesn't have a lot of perspiration on her forehead. If she does, I want to pat the area dry so that it's a dry surface for the thermometer to go over, okay? So a temporal artery thermometer looks something like this. There's a button on the back side and then a probe area. They do sell probe covers, but it doesn't really cover much of anything. So as long as we just give the probe area a swipe with alcohol to disinfect it in between patients, we really don't need the covers for this. There's low cross-contamination in this case, unless she had a sweaty forehead. Then, like I said, I would take steps to dry that. So to use a temporal artery thermometer, what I'm going to do is I'm going to place it on the center of the patient's forehead, press the button, keep the button held in, and go straight across into the hairline. We have an artery, the temporal artery, that runs through our temple, and that's what we need to go straight across. So when you do a temporal artery, always think T, okay? A very common mistake when people do a temporal artery is they start in the middle of the forehead and then they go down around and they run with the hairline. And depending upon where the patient's temporal artery is, you could miss that. So T straight across. You got to kind of cross the T at the top, go right into that hairline, and then once you get into that hairline, you can release both the thermometer and the button, and then you'll have a digital readout on the thermometer, okay? All right, Jessica, so what I'm going to do is I just need you to look straight forward. This shouldn't hurt at all. So I'm going to put the thermometer directly flat on her forehead, press the button, and go straight across into the hairline, and just let go. And then I have my reading on the bottom of the thermometer in digital format. All right, and then I would go to my chart, start with my peanut butter and jelly, my date, time, and then capital T for temperature. The reading, in this case, 98.3 degrees Fahrenheit, and then I would sign it if I was just taking a temperature. Okay, so again, cannot stress enough, don't curve on the forehead, go straight across. This is a great way to take a temperature on pediatrics. It doesn't matter if the patient is young or old, as long as they don't have a very sweaty or a lot of perspiration on their forehead. This is a quick, easy, very accurate way to take a temperature.